This is the Young Changemakers Podcast, a global changemakers production. I'm Huiti, and together with Megan, we will be your hosts for this season. If you'd like to learn more about the resources and programs that Global Changemakers offers, visit www.global-changemakers.net. Welcome, everyone, and welcome back to another episode of the Young Changemakers Podcast. My name is Huiti from the Global Changemakers team. And again, I'm really excited to be here. Today's conversation is with an amazing change maker by the name of Khartik. But I never like to start off introducing my guests because I just love it when they take the opportunity to share a little bit about themselves and that journey. And so welcome, Khartik.
Yeah, thank you for having me on the podcast.
We're really, really honored to have you here. So before we go anywhere, here at the Young Changemakers Podcast, we love to start off with something that we call checking in with ourselves. So as young changemakers, we often do all this amazing work, and sometimes we forget to check in with ourselves and see where we are. So I just want to find out from you, on a scale of 1 to 10, how are you feeling right now? And if there's any word that you would use to probably describe your mood right now, what would it be?
Yeah, so right now I think I'm at like a 8.5. I think it would be higher, but it's like 6 a.m. in the mornings. I think it will rise throughout the day. But I think right now the mood is very excited because, I'm doing an internship right now at Princeton. So we had like the weekends off and it's Monday, so I'm going back to work after the weekend. So it's a new week, a new part of my project. Yeah.
Oh, that sounds amazing. And it sounds like you're already doing amazing work there. Congratulations on your internship at Princeton. And I'm really happy that you're excited above and beyond the work that you're doing. It's always so good when we get an opportunity to have our change makers actually doing well. Wellness is such a big and important topic for us at Global Change Makers. So a little bit of an icebreaker before we start talking about your amazing work. We love to call it this or that. So I just want to find out, are you a morning or an evening person?
I think definitely an evening person. Yeah, I usually don't wake up this early, but I think with the summer starting, I started waking up a little bit earlier because of my timings for the internship and all. Usually I'm there by 9 o'clock. So I think I've adjusted to that schedule, but I think usually evening for sure. Yeah.
Oh, that's nice. All right, so a summer or winter person?
I think definitely summer. There's a lot more time to, do more, and because there's you have 8 more hours of the day, which you usually spend in school, and then I think that also a lot of people take the summer for granted, but you can achieve a lot because it's a 2.5 month period, which is a long time. I think that's 10 weeks, 11 weeks.
So you're definitely thinking about the summer break, but I'm also thinking the weather. It must be nice to a little bit like be on the warm side versus when it's really cold in winter. All right. So last question would be, are you a tea or coffee person?
I think I would say I'm like 50-50. I was actually asked this on Thursday, so I don't know where I'd place myself. I'd say it depends on the time of day for sure. Yeah.
All right. So thank you so much for sharing a little bit about yourself. These are just a little bit of icebreakers just to get our conversation going. But Khartik, oh my God, your profile is amazing. The work that you do is amazing. You're a change maker who's particularly passionate about health equity and AI innovation within the health space and just healthcare policy reform, particularly around rare diseases. So I just want to find out from you, could you please share a little bit about your background and really what kickstarted your journey in this advocacy space? Just share a little bit about your interest within this field.
Yeah, so I think around 2021, 2022, during the beginning and middle part of the COVID pandemic, I was diagnosed with 2 rare diseases. So one is lymphedema and one is arteriovenous malformations of the hip. So, especially during the middle of the COVID pandemic, it was very difficult navigating how to deal with these rare diseases. And it was very difficult to get it diagnosed because a lot of doctors would say, oh, it might be COVID, it might be this, it might be that, but they wouldn't be that confident in what it is. So after eight doctors and like going to some of the best medical facilities in the US, They gave me both diagnoses at the same visit, but even to this day, they don't know what caused um, either of the diseases. They just know I have it. So a lot of the treatment initially was based off the symptoms and not really the source of the disease. And the issue is, after researching more into the rare disease space and my diseases especially, I noticed that the story is very common for a lot of people with rare diseases where they will never know why they have a rare disease. They'll just know that they have the rare disease. So it's very difficult to treat them. And it's also difficult to navigate them or manage the symptoms. Luckily for me, over time, it became less and less severe, especially because there's a theory that a lot of the diseases are something you grow out of, and it might be like a temporary thing based on like the environment of COVID, maybe being like more sedentary, things of that nature. So luckily for me, it became less severe as I started becoming more active on a daily basis. But for a lot of people, they've been struggling with their rare diseases and it's been getting even more worse. So seeing that inequity in the rare disease space was very eye-opening and pushed me to go into the health equity sort of movement within and focus on rare diseases. And a lot of my work has been focused on the youth because I'd go to a lot of rare disease conferences initially, and I'd see that there's a lot of professors, advocates, and so on and so forth, but they'd all be very old, right? They'd be either like parents or professors or people who are in the middle stages of their lives, right? Like 40 and over. But that's very interesting to me because most people with rare diseases are very young, under 27. So I was confused. How are people making policies for people with rare diseases when none of them actually have rare diseases, right? So I thought that
Yeah.
we need some kind of forum for people with rare diseases, especially the youth, to contribute to these conversations and to have their voices represented.
Wow. Thank you so much for being vulnerable enough to share your story, and your own diagnosis. I'm sure, like you've mentioned, it's been it's been a journey of consultations with multiple doctors, but actually getting to a point where you're getting a diagnosis. And I'm sure now being able to get the necessary care and adequate care as well in your journey, navigating life with these rare diseases. I really love that you used your own story to identify a gap in your community and in the world within the advocacy space for youth. We always say you're going to be coming up with solutions for the people that you are not involving. So the very people, the youth that are in the rare disease community have to be at the table so that they're able to tell you what they need and share their lived experiences around just navigating healthcare, and in order to have that good healthcare policy reform. Now, I want to find out from you, Khartik. You're balancing high stakes policy deadlines. You've done some amazing work with global organizations such as the United Nations, for example. You're balancing those deadlines with high school life. You're doing so much work. So I want to find out from you, and I'm sure it must be really, intense. How do you manage your time, and how have you developed, any personal systems or routines that maybe young leaders might learn from you within your advocacy space?
Yeah, so I'd say the main part of performing sort of active advocacy on a daily basis is you have to figure out how to delegate tasks efficiently. We can all try to optimize our schedules to have the most time to work on what we're passionate about. But the thing is, at the end of the day, there's only 24 hours in a day. So no matter if we save an hour or two, like here and there, it won't really make much of a difference. The main difference is getting more people involved in your cause to contribute one more person worth of work, right? Because then you get 8 to 9 more hours of work throughout a week, like minimum, if someone's very passionate about the cause just like you are. So finding those people who are passionate and dedicated to working for whatever cause it is you're advocating for is the main thing I'd say has helped me with my advocacy. And luckily I was in good hands because there is no current outfit for youth with rare diseases. And there is one other organization. They are not entirely youth led, but they do have a youth advisory board. but the thing is, like, you know, they're not really calling to people in the same way because these people are not familiar with those adults who are running it, but they're more familiar with me, who they might have seen at conferences or online or something of that nature. So if you find a community where you can easily access people who are interested in the same issues as you, I think it becomes much easier to run your organization, advocate for your cause.
You're really bringing up a very important topic that I really, really love and admire, which is collaborative work. You know, we get far by finding like-minded people that literally are advocating for the work that we're doing. And that is one of the key pillars that we have at Global Changemakers, creating a support system of young changemakers who we not only provide with grants and community skills development, but also we provide them a safe space in a community to be able to think through the ideas, supporting them, their well-being, as I mentioned in the beginning. So I'm really glad that you're bringing that up. And it now actually guides us into the next part of our conversation, which is the amazing work that you do at the Region Network. So you're one of the co-founders of this amazing youth-led organization. Tell me a little bit about it. What's the vision behind it, and what are the key objectives that you have at the organization?
Yeah, so going back to my experience during COVID with rare diseases, because for one of my diseases, lymphedema, it was very, very rare because most people with the disease develop as like an acquired condition after, let's say, like a surgery. Most commonly, it's like a side effect of breast cancer surgery, right? So for me, I got it genetically. They believe genetically out of nowhere. So it was very shocking for me because very little people had that same condition. Most people acquired it in the later stages of their life, and it would be very hard for them to recover. They had their own experiences completely different from mine, even though we technically had the same disease. So really had little to no resources to sort of navigate my diseases. So that's when I started turning to, the rare disease space as a whole, because I noticed that even though our specific conditions and like the exact like quality of life was different, we had a lot of common shared experiences. So it was really easy to build off of each other's knowledge, even though we might not experience the exact same things on a daily basis. So that's when I started getting involved in rare disease advocacy and building sort of a network in the rare disease space where I could turn to others and ask for tips, advice, whatever it is regarding handling rare diseases. And then in that same process, I got more involved in the rare disease space. I, noticed these inequities where like a lot of people were excluded from rare disease advocacy and rare disease conferences and rare disease summits because, they didn't have the quote unquote credentials. They weren't doctors, they weren't PhDs, they didn't have degrees in public policy, so no one would take them seriously, right? Especially when you put them in a panel after two doctors at Yale or Harvard Medical School who've been doing research for 20 years or more. So I noticed that, especially because the rare disease community is small, that was even more exacerbated. You wouldn't have that many outliers who are challenging that. So, there is a place for people like that who are very experienced academically, because of course they're contributing to the field, but I thought that, you'd also need to have the patient's experience in rare disease advocacy, especially because most patients are in their youth, they're under 27. So, and even within that, under 23 is the like majority group within under 27. So it's even younger than we think. So I thought that having an organization that's entirely youth-led, only the youth are involved, would be very useful to have, because then, we'd be able to pave our way into these spaces and create a voice for ourselves. So initially, like, a lot of people in the rare disease space were like, why does your organization exist? What is it doing differently from the other smaller organizations that are specific to a single disease? Because that's the norm in the rare disease space, like having one organization per disease. And, my philosophy is that we're not there to replace those organizations. We're there to reform those organizations and create a space within them for people who are in their youth to contribute.
That sounds amazing. So really, you are bringing together youth that have been impacted by the rare diseases to have sort of a unified voice, and be able to show up in these spaces and advocate for the youth based on their experiences.
Yeah.
Yeah. No, I'm really learning a lot from this conversation. Thank you so much, Khartik. And I just want to take this time to encourage our listeners to subscribe and continue to be able to hear amazing stories from changemakers such as Khartik, who are doing amazing work and showing up boldly in spaces where youth are usually excluded, right? And so the youth voice is being showcased as a powerful advocate, rightfully so, bringing strong ideas and lived experiences to the table. Khartik, what are just some of the challenges that you've experienced, creating your network? As you said, the young people are not really given that space within the summits or within the community around research. What have been some of the challenges and how have you overcome it at the Regen network?
Yeah, so initially the main challenge was not so much recruiting because the rare disease space is very undersaturated and it's a small community. So if you're part of it, it's really easy to get support from people who are interested in your cause. So that's one advantage I had when building up Rarigen initially. I'd say the biggest challenge was getting into these sort of rare disease spaces because there was no one before me who had set like a trend of youth-led discussions, right? So I was the one to introduce them in a lot of cases. So, getting time at these conferences and meetings was very challenging because a lot of rare disease organizations are already very pressed for time and money and venues for events. So it's very difficult for them to agree to allowing a new youth-led organization to take part in their sort of decision-making process, especially initially when you have no track record. But, after the first conference, it became easier and easier each time. And I'd say, the main thing was at the first conference I went to, I specifically remember that they were spending hours and hours throughout the day talking about why aren't rare disease patients registering for XYZ tool? Why aren't they taking part in XYZ study? And I was sitting there thinking, it's because you're not communicating with the people with rare diseases. You're communicating to these people who are not in the target demographic. And, I used that, my speaking opportunity, my question, they had like an open mic. I used my questions to sort of shed light on that issue. And, after that, they came up to me and they said, would you like to speak during the next day? We have like maybe 30 minutes or so. And I was like, yeah, I'd be happy to speak. And, from that, people started taking Rarigen and the youth-led cause more seriously within the rare disease space because, it's like it clicked in their heads. They're like, okay, so this is why we can't connect with the people we're trying to help. If we work with the youth, we can actually start making our tools better and alleviating a lot of issues in the rare disease space. Because going more into the technical side of rare diseases, there's a lot of tools that are emerging, but these tools rely on large amounts of data. So when data is not available to test them, they collapse. They spend months and months building them, but literally after like a couple of weeks or a month, they shut them down immediately because they know, okay, there's no future for this tool. No one's using it. No one's contributing to it. So, if they work with the youth who can provide data, then they have a large success rate for these tools and they can continue expanding them so they can be used by clinicians, right? So I think they've noticed that there's an advantage to working with the youth, especially in the rare disease field.
Wow. One thing that I'm realizing is that in your advocacy, you really do need the support of the people within the community, right? So I just want to find out from you, the different stakeholders, how has the reception and the support been from the level of, let's say, even your families, your own medical doctors and the hospitals that are there, all the way to the researchers and the professors that you've mentioned within the Regen space, right? So I want to find out from you, how has the support and the reception been? How has it evolved to now today once they've heard your voice and the contribution that your organization is bringing, as you've mentioned?
So I think generally people are excited about seeing a youth-led organization in the rare disease space because it's not something they're opposed to. It's not something they feel negatively about. But I think even though there's some personal excitement, once the excitement is off, when it comes to actually interacting with them, um, they're not so open. But there was a lot of good rare disease organizations that are very large, like RDI, which is, I think, the first or second biggest rare disease organization internationally. So they were very supportive, and they offered, membership to us. I think we're getting voting rights next year in their decision-making process. So they've signed multiple agreements with the WHO. They've met the Secretary General. They're very experienced in the policy field for rare diseases. So those sort of larger rare disease organizations took us very seriously, offered a lot of support because they were genuinely interested in the cause. And they've been around for a long time, so they know that this is an issue that we can't fill directly so far. And you guys are here, so this is our opportunity to, fill that gap. And they've the good part about RDI and all these large rare disease organizations that supported us is that they're entirely patient-led. So, they spend a lot of time on the issue because they're personally involved. And they've done a lot of research on the rare disease space, policy-wise, what needs to be done. So, they were informed and they realized that what we're doing is a good thing. But, talking with a lot of the small organizations has been more difficult because they're hyper-focused on their disease, especially on the research side. They understand that policy and research go hand in hand together, of course, because you need policy to get research going and get it accelerated, but they don't necessarily know exactly how much policy affects research. So they're a little bit more apathetic towards the cause, not as interested. So the main thing about which allowed us to get into those spaces was that a lot of our members had been parts of these small organizations for years, right? Because those are the main support networks for their diseases. So they were able to convince their directors, their leadership to, give us a chance and to see what we have to say. And then from there, it's been a positive reception after that.
Wow, I'm really, really impressed with the reception. I'm really, really happy that that has been the support that you're receiving. And I'm really excited to also just see how much the work that you do will grow, especially now that next year you'll be getting voting rights and actually having a space at the table to influence directly policy reform within the rare disease space. Congratulations on that, by the way.
Thank you.
So within the Regen network, you have actually mobilized more than 400 students probably across the Regen chapters to amplify BIPOC rare diseases, voices of people within that space. So I really just want to find out. And you've actually helped to pass over 15 state Senate resolutions within Maryland and Virginia, which is such a big deal. Congratulations on that impact. But I want to find out, how did you strategically actually build then the local to state pipeline where you are now able to really influence and have your advocacy influencing some sort of legislative framework? And tell us a little bit about that journey and that experience.
Yeah, so the main benefit that allowed me to start going into that state level policy making space is out of all the states in the US, seems that Maryland especially is very easy to contribute to, state legislation compared to my home state of Virginia. And there's a large health policy focus because Johns Hopkins Medical School is located within Maryland, and they're a big force within the area. The NIH is also located. There's some of the largest health institutions in all of the U.S. and even internationally are located within Maryland. So there's a strong emphasis on health policy. So, working with a lot of state representatives and state senators was really easy because they didn't need extra convincing to know that health policy was a big issue. They mainly needed convincing on the rare disease part of health equity and the youth space. And I think that, after getting across to them that a lot of their constituents are interested in rare disease policy and they're being directly affected by these bills, they were very shocked. Like, they didn't have anyone talking about rare diseases, especially the youth. So I remember the first time we got a bill passed, there was a lobbyist. He was speaking for, I think it almost went on to an hour, right? In like a 3 hour long or 4 hour long session. We were there from, I believe, 12 to 4 that day. So he spoke for almost 1/4 of that, right? So he had his chance. They were questioning him. They're writing down what he had to say seriously. And then immediately after he went, we had a 5-minute speech. And after that 5 minutes, a lot of them got up and they were congratulating us, and they're telling us that, our 5 minutes of words really convinced them to sort of ignore his 1 hour of talking, right? So I think that human connection and seeing the youth involved in advocating for something that they'd never hear of without us being there was really eye-opening, and a lot of legislators start to take us very seriously because, at the end of the day, these are humans, right? So they have compassion, empathy. They're really public servants, right? They're focused on the people, on the constituents, serving them best. So when they hear of issues like these, they're genuinely concerned. And in the state of Maryland, the reason I chose to work there first is because they don't need extra convincing to know that health equities are a big issue. It's generally easier to work there because of that in the rare disease space. And from Maryland, we started expanding more once we built a base there.
Wow, this is really a testament to all the young change makers that are listening, that you must knock on the doors, you must write those proposals, and you must literally submit those ideas that you have to all the different stakeholders that you want to collaborate with or where you want to go. It might not always be easy, but when you sit and literally do not do anything and go into those spaces to try and get your voice heard, then you miss out 100% on that chance versus literally submitting and showing up and asking the questions at your town halls and all the different spaces and the different platforms that have been created for us as young people to interact with public servants and just other leaders within our communities. It really resonated that 5 minutes of impactful, meaningful human connection through words can get us very far. So we shouldn't despise the time that we're given or the opportunities or the different platforms that we're given as youth to put our voice out there about the work that we're doing, especially because we know that we're advocating to have a positive impact in our communities. So I just want to find out, right now, technology and social media actually is booming. And, it's such a powerful tool to mobilize youth, to spread the message that we have. I want to find out from you about the work that you're doing at Regen. How is AI come up in the work that you were doing? And how do you use technology as a whole and social media to actually leverage them as platforms to effectively get your message across?
Starting with the AI part. So there's not that many organizations in the rare disease space generally. So when you're leading a rare disease organization, it's very hard to build one specific niche. So you have to do a lot of things at the same time, juggle a lot of tasks. So one of the things we started doing recently is research in the rare disease space. But our methodology is unique in that when we're doing research, we're not focused on one specific disease. We're not focused on basic sciences. We're focused on clinical sciences and clinical tools that, if they work and they're approved, they could be directly used by doctors. And the way we get the intuition of what sort of tools to make is, by surveys within our own community of what would people with rare diseases like to have, given these 3 options, what would you like to have, or what are your 3 most difficult, challenging problems right now at this current time that you would think need to be addressed. So, because we have access to a large amount of people who can provide input on what to do, it's really easy for us to start identifying issues and making tools. And what AI does is, AI learns off of data. So rare diseases usually have limited data, so it's hard to work with AI. So we've been having a specific team dedicated towards AI where they discover very new and up-to-date models that use less and less data and use them to generate more data for us to use in the future. So synthetic data generation. And with that synthetic data, we can build more AI models and we can share that data with the community for them to use and build their own sort of tools. I think similarly, what we've seen in other fields is that there's OpenAI, for example. They're open sourcing a lot of their data for the community to use so people can build AI at the same time, because it benefits them if there's more innovation happening at places like research labs, industry, because at the end of the day, it's all common knowledge. It's all shared knowledge. The more shared knowledge we have, the easier it is to build tools. So our idea was to do something similar in the rare disease space, so people who need data can have data, because, data is important for AI. It's important for building software. It's important in a lot of, use cases. So having that data is very important. And then moving on to the second part of the question, I'd say that social media was a really big tool used back in the day, especially in the early stages, because during the COVID pandemic, no one could meet face to face, so we all had to meet virtually. And disseminating information via social media was the best way to reach the largest amount of people possible, especially internationally, because it's very hard to expand past your local network for any organization. So when you work with sort of social media tools, it helps you expand to an international audience and reach more people across different countries, which only strengthens your organization, because you get more perspectives and you get a larger working area. You can represent a larger array of issues. So I think social media is very valuable in our organization, getting people to join who didn't live in the US or didn't even live in North America, right? So that was a really big tool in shaping our organization's expansion.
That sounds amazing, Khartik. You're really bringing light also to how technology now is really accessible, or really starting to get accessible to more and more young people. So it's no longer like back in the day, we would have to wait to be a certain age to be able to be innovative within the AI space and see what can be done, bringing our ideas to life. If anything, this is a testament to go out there to see what tools are already available, learn about them, and then also bring in your ideas and innovation within the space, within your advocacy. Thank you so much for the time that you have spent with us. You're sharing your journey of impact, Khartik. We cannot thank you enough. Guys, this is Khartik Uppalapati from the US, doing amazing work in health equity. My last question will probably be, what advice do you have for a young person out there who says, I want to start doing advocacy work within health equity space, not just for rare disease, but in any aspect altogether? What advice would you give to them as your last words for closing?
I would say the first step you should take is be ambitious, right? So find a relevant stakeholder. For me in the policy space, naturally it's legislators, right? So I literally found a specific bill I was interested in, emailed my legislator's office, offered suggestions on how to reshape the bill, make good amendments to it, met with them, wasn't satisfied the first time and went back a second time and waited 7 hours to meet with them, right? So I think people will see that dedication and they'll start taking you seriously, but unless you take that risk, you won't really get anywhere with what you want to do. So it's all about how much effort you want to put into it, whether you're willing to take that first step. Because, I drove 1.5 hours for a 5-minute meeting the first time, but the second time it was much more productive, right? We spent hours sitting there talking. So I would say doing something bold, doing something that people would usually question is the best use of time, because, if you don't do something bold, you'll get normal results, which might not be helpful, might be helpful. So taking ambitious steps towards your goals is the main thing people should be doing if they want to leave a mark on their communities, their societies, their mission. Yeah.
Wow. I always have these moments during the episodes where I call them my aha moments, or what I like to call the I'm going to coach you moment, right? And for me, it's definitely this one, Khartik, where you're saying be bold and put in the effort to actually advocate for the work that you want to do. Mm-hmm. Be bold, put in the effort, audacity, be audacious in the work that you're doing, because it really is for the benefit of your community. I cannot thank you enough for the amazing work that you are doing. I cannot thank you enough for the time that you have given us and honored us with here at the Young Changemakers Podcast. But our listeners probably want to know, where can they find you? How can they interact with you and the work that you're doing? If you have social media, where can they find you as well on social media?
Yeah, so you can interact with me directly at khartik@origin.org, or you can go to the website www.origin.org, and then you'll see all of our various social media, LinkedIn, whatever it is you're interested in. But yeah, always feel free to reach out to me directly. Yeah.
Thank you so much. And with that, ladies and gentlemen, we come to the end of our episode with the amazing changemaker Khartik. It's been such an amazing experience learning a little bit more about the rare disease community and the advocacy work that he does. We cannot thank him enough. Remember, go out, reach out to the Region Network, Google them, the website will come up, and let us educate ourselves and learn a little bit more about this amazing space as well. Because one thing is for sure, we are all impacted in one way or another. We're all affected in one way or another. So with that, thank you so much. And we cannot wait to have you on another episode of the Young Changemakers Podcast. Thank you for listening to the Young Changemakers Podcast, a Global Changemakers production. Remember to like, share, and subscribe to the podcast wherever you listen to it. And if you'd like to find out about the resources and programs that Global Changemakers offers, visit www.global-changemakers.net. Until next time.